From Raleigh, Durham, North Carolina, and New Delhi, India, we present the Health Channel at IBM TV. I'm your host, Nick Palavita, along with the co-host, Kim Calhoun. We have a and of course, Ankit, who's going to be leading our discussions. We have a very special guest, Dr. Rajat Gupta from New Delhi. Dr. Gupta, welcome to the show.
Welcome.
That's
Welcome
right.
to the show.
Yes, and
Hi,
Ankit. Hey,
Yeah,
Ankit. Yes, and of
yeah,
course we know Ankit because he's been doing this for a long time. And Ankit, we're going to be going over the health industry in India, right? So you have a series of questions you want
yeah.
to discuss with. Let's get started.
So I'll start with the initial question of how you started ORLIN Clinic and what is the objective behind the clinic setup after your day job.
Hmm.
So, in Indian scenarios, Ankit, you're very well aware that it's very difficult for patients to get across doctors because of busy schedule. So there were patients still waiting, lined up, wanted my appointment. So I thought of starting my own clinic in the evening shift and probably be able to be more accessible to patients. So that's the whole idea behind. So it's my love, and I designed the whole concept. I named the clinic as ORLIN, which is a German name, which means renowned in the land. So I have a common venture along with my wife. She runs the dental clinic. So it's the ORLIN Dental Clinic as well as the ORLIN Spine and Pain Management Center.
Okay. And you did some of your training in McGill University in Canada, is that correct?
Yes, I did. In the year 2013 to 2014, I was in McGill, and I was trained under my supervisors who were originally from Canada. A few of them were from Spain, Iran. So I was blessed to be trained under multiple supervisors. So it was a wonderful experience, and thanks to the training, I'm here surviving for the last 5 years.
Okay.
How do you see the Indian healthcare industry growing as compared to the industry back in Canada?
See, the whole scenario is very different. So in Indian scenario, we have both public and private, but in Canada, we have mostly public healthcare system. So when I was there in Canada, so there was a long waiting list. So the patient who wanted to see me had to wait for almost a year. Now in India, that's not like the case. If you want to see a specialist, you can directly take an appointment and walk in. Unlike Canada, you need to go through your general practitioner, your primary physician, who would refer the patient to me. I will assess the case, whether required or not, and accordingly triage the patients. So it's quite different. So I feel both have their own goods and bads. So this is how things are.
And
Almost
what about the
a year before somebody can see a specialist, though. I mean, you could suffer a long time in a year, and if you seek that specialist out quickly, and I've learned this, you can fix the problem quickly, right?
I totally understand that, and that was the main thing. So we used to triage the patients who needed us the most urgently, like the patient suffering from cancer pain, was seen at the priority basis, or patients suffering from major pains like chronic pains on high doses of opioids. So they were seen pretty early. But the patients who were like young, not suffering from that much of pain, so they were accordingly given appointments.
Okay.
And who decides the priority of the patients?
The director of the clinic. Dr. Sher was the director of the clinic, and he used to go through the whole list, read the symptoms and the history and the examinations sent by the general physician, and then decides who to be seen at what time.
That's the toughest part, I think so, because to judge a patient before he's treating by the doctor, and I don't know how they will hierarchy and they will prioritize the patient's disease.
I agree.
And what about the quality? If you talk about quality back in India and as compared to the global healthcare among doctors, there are a lot of doctors who are crossing the borders from India to US and other countries. So what are the difference, or what are the practices and qualities they are practicing on day to day as compared to Indian doctors?
See, in Indian scenarios, more or less we are as comparable to the Western world. But the only major difference here is that there are more strict policies and rules and regulations in the Western world as compared to India. And in terms of both medical, the medicines, the pharmacy, and everything. Moreover, the number of patients we are seeing here is huge per day as compared to people in the Western world. So we are seeing around 30 to 40 patients a day. So the amount of time we spend with the patient is definitely lesser as compared to the Western world. I remember I used to spend around 45 minutes for my new patients and around 30 minutes for my follow-ups. Unlike here in India, probably I'm giving 15 minutes and 10 minutes, 15 minutes for my new patients and 10 minutes for my follow-ups. So definitely the quality is being compromised. But again, you know, the more numbers you see, the more experienced you are. So probably you get more wiser seeing patients over 15 minutes rather than spending 35 minutes with them.
Do
And
you,
how many
just a quick question here, do you see a rise in the practitioners coming out of school now? It sounds like there's a need for that, but do you see a rise in that?
There is definitely a rise in the practitioners coming in, but there's a long latency period in medical fraternity before you settle down as a full-fledged practitioner. And nowadays, the young generation coming up wants easy and faster money, so they don't have the patience to be grilled over the years. So it's been like I'm around 40 and I've been into the medical stream for almost 23 years. So you need to be really slogging and really putting in a lot of efforts and keep yourself updating. So probably people are coming in, but still I think they have more inclined towards non-medical professions and non-medical jobs because of easy settlement and faster settlement.
Right. I'm sorry to butt in like that. Go ahead.
Yeah, go ahead, Ankit.
So India has a vast healthcare system as compared to the Western world, and then we have urban, rural places to qualify the patients. So how do you think we can bridge the gap for the people who can't afford your services or who can't reach to you as a vast
See,
country?
the government of India have been recently coming up with uh, tertiary care centers in the rural areas, such as AIMS, the All India Institute of Medical Sciences, being opened up in various parts of the country to serve the rural population. But we understand the problem behind not settling, all of us not going there and settling down as practitioners in rural areas because of the education and the facilities given to our children and our families. So probably that is the factor which is holding most of the doctors back, though they are being well paid. But so we are just trying to build up more tertiary care centers, give people more salaries, provide more day-to-day routine facilities for the doctors and their families. So we can bridge the gap by doing that.
And if we talk about healthcare technology, so is there anything in technology in terms of pain management which we can offer to our patients at a global level sitting in New Delhi?
See, technology-wise, we are at par with the Western world. We are very well equipped infrastructure-wise. India is no less economically. So, pain management has really evolved in the last 10, 15 years with the technology coming in, especially with the use of the X-ray machines and the ultrasounds and the CT scans. So it's all guided procedures. It's like interventions like we do for a heart, we do angiography and angioplasty. Similarly, we do different interventions for the pain procedures. So technology has really given an edge in the medical stream, and mostly all the streams, upcoming streams like surgery and orthopedics and everything are using more technology based approach, and it has given a big boom to medical industry.
And do you have patients abroad? How do you see them or how do you follow up with them? If
I generally Similarly, I've been taking those patients on Skype calling. Now, it's difficult to give them treatment without assessing them clinically. So I generally prefer patients who have already shown me in the clinic or in the hospital once, and I've examined them and I know what the illness is. So I can follow up with the medications on Skype. But I generally don't see a new patient on video calling or phone calls because I haven't seen the patient.
Right.
And what about the government support? Is there any government support you would like to have from Indian government as compared to the Western world or global presence? Because there are a lot of things which government is offering, but it's not able to reach out to the last year. So how we can, I mean, what can be done in that scenario?
See, it's all about the government is in the government of India is really helping both doctors and patients by controlling the prices of the various medical devices and the implants. In terms of for doctors, yes, they are opening up more tertiary care centers, giving them more higher salaries and better facilities for their families. So definitely, if the government of India looks into this issue, we can probably be at par with the Western world by serving our rural population as well.
And we've seen that you have a website called orlinclinic.com. So how you are managing that website and how you are getting more clients from those online presence?
So I'll be very honest, Ankit, thanks to you, I'm being able to manage. You are the force behind managing my website, and your team is doing a wonderful job. So lately, last couple of years, there's a lot of trend in medical stream of people searching for reviews of doctors, how they're doing, what all they are being trained into. And so we are updating our knowledge and updating our social media as with the help of you guys and able to get more patients.
Nick, can we pull up that website?
I think Ankit has become the new presenter, so he's up with it
Ankit,
right
you
now.
want to pull up the website so that we can show the viewers?
I think I have it already. It should be right here. Just a minute. I have to be the streamer.
Yeah, please do it.
Just a minute. I'll show you the website. It's a good website.
Gee, I wonder where it came from.
Okay, here we go. And there it is. Do you see it?
Oh, wow. Yes, I do.
ORLIN Clinic, right. Okay. So the thing is, it tells you about the clinic. Apparently, they do dentistry and also pain management, spine pain management, dentistry. And there is the ORLIN Clinic with Dr. Gupta. So
wow, that's
so
beautiful.
All right. So yeah, it's all accessible on the World Wide Web. So anybody in the world, and we do beam at IBM TV all over the world. If you happen to be in New Delhi, there you go, ORLIN Clinic. Now I understand you're in South New Delhi. There's a South and North New Delhi. Would that be correct, Dr. Gupta?
Yeah.
Okay.
So Delhi is basically being divided into Old Delhi and New Delhi, and then further divided into South Delhi and North Delhi. So I'm the southern part of Delhi. Yeah.
Okay. Right. Yeah. So it's a big city. What, Ankit?
I'm from North Delhi.
North Delhi, okay.
North Delhi.
North Delhi, South Delhi. You know, it's all New Delhi to me, all news to me. But no, we're running out of time, so I do want to thank Dr. Gupta for coming on IBM TV and also explaining, the differences between. The first thing I learned was the difference between the Indian healthcare system, the Canadian, and obviously the U.S. system. We are on three real different worlds when it comes to healthcare. And as we see this, IBM is also making a strong push into the healthcare industry, and hopefully we'll be able to see improvements as time goes by. So
one of the things too I wanted to comment on isn't just how we saw the difference in all of these healthcare systems, but we also saw how we're connecting them and pulling them together. And Dr. Gupta treats people in all of the different parts of the world, not just in New Delhi. So
yes, and thank you for coming on the healthcare channel at IBM TV. We'll see you next time. Bye-bye.
Thank you, Dr.